Do biologics increase colorectal cancer risk in IBD patients? When it comes to inflammatory bowel disease, many people wonder if the medications used to control symptoms might also increase the risk of colon cancer. The good news is that current research shows biologic therapies do not raise the risk of colorectal cancer in patients with inflammatory bowel disease. In fact, some studies suggest that biologics may even help lower the risk of developing advanced cancer, especially in those with ulcerative colitis. Inflammatory bowel disease includes conditions like ulcerative colitis and Crohn's disease. Both involve chronic inflammation in the colon, which over time can increase the chance of developing colorectal cancer. This increased risk is mainly due to the long-term inflammation itself, not necessarily the medications used to treat the disease. Persistent inflammation can cause damage to the DNA in colon cells, promote oxidative stress, and activate pathways that lead to cancer. Other factors like genetic mutations and changes in the gut bacteria also play roles in increasing cancer risk in these patients. Biologic treatments are designed to target specific parts of the immune system that drive inflammation. For example, they often block tumor necrosis factor alpha, a substance involved in inflammation. By reducing inflammation, biologics help keep the colon healthier and may prevent the cellular changes that lead to cancer. Recent studies indicate that patients with ulcerative colitis who are on biologic therapy tend to have a lower risk of developing advanced colon cancer. However, in Crohn's disease, the evidence is less clear, and more research is ongoing. It's important to remember that, while some immunosuppressive drugs can carry a theoretical risk of increasing cancer, biologics have generally been found to be safe in this regard. The main goal of treatment is to control inflammation, which is the primary factor behind cancer development in inflammatory bowel disease. Managing inflammation effectively can be a key part of reducing long-term cancer risk. Patients with inflammatory bowel disease should continue regular colon cancer screening, which often involves colonoscopies to look for early signs of dysplasia or cancer. Treatment plans should always be personalized, based on individual health factors, and discussed thoroughly with healthcare providers. Keeping inflammation under control is essential for colon health, and biologics are an important tool in achieving that goal. Overall, current evidence supports that biologic therapies do not increase colorectal cancer risk and may, in some cases, help protect against it.